everybody, it's Dr. Dady, Center for Health and Healing. Hope you're having a great day. Today, I wanted to spend a little bit of time just talking about low T and really telling you what that exactly means and how you can fix it without just giving you testosterone, because that is not the answer. So how do we get low T? In a minute, I'll show you some hormones and I'll explain a little bit more in detail to you. But for now, low T, most of the reasons is when you have excessive testosterone, it will just go downstream and make more estrogen, estradiol, estrol. If you have insulin resistance, it causes an upregulation of the enzymes and it will convert testosterone again to estradiol. In that case, you'll start having problems with things we call LH and FSH. So two other things, blood sugar can cause it, and low zinc. If you find out why you have low T and correct that, you won't cause all kinds of hormone dysregulation in the system, because believe it or not, men have many more hormones besides testosterone. And I wanted to share my screen with you and show you this. So first of all, many people really don't know this, but cholesterol right over here to your left is the very first hormone. Believe it or not, you need cholesterol. Then it converts to pregnenolone. When you're under a lot of stress, these little things called adrenal glands will steal pregnenolone and convert it to cortisol to help you deal with stress. So cholesterol will come down and give enough pregnenolone to this, and then it will be decreased if you're under stress. Then we go to DHEA, which makes all of the rest of the hormones. So cholesterol, pregnenolone, then to DHEA. So here we have all these hormones. So here's testosterone kind of laying in the middle. You have all this other stuff going on. So if there's too much testosterone, look what happens. It spills over, it makes estradiol and estrone, which is, for men, you don't need that much of it, right? Women need all the estrogen. It is really just a balance. It's a nice dance. And also, if testosterone's too high, it'll shuttle over here to DHT. You know why people go bald or lose hair? Well, losing your hair, you go bald, right? So DHT goes up. And when that goes up, many other symptoms too go along with that. So what do you want? You just want a balance in this. Cholesterol medicine, see what would happen? You give cholesterol medicine, it lowers cholesterol, then you will have a downregulation of this, and then you'll have problems making all the hormones. So if cholesterol goes up, it's usually a sign that there's stress, and now it cannot make these hormones. So anytime you have an imbalance in these hormones, there's a lot of different reasons. So finding those reasons are important. I like to use saliva. Saliva testing tells me exactly, I'll see this whole story, tells me exactly what you are using. A blood test would tell me what's bound to the blood. So the hormones are bound to the blood. I say sitting on a chair of protein, waiting to be used. So if you take a blood test, you're just looking at bound hormones. So I like to take this saliva test and do some blood work and make sure that there's no insulin issues, there's no zinc deficiencies, make sure the gut's working well, so you're absorbing nutrients and there's no stress there, and on and on. I call it rebuilding the house. So if you want to know anything else on the topic of low T, go to drdady.com, or you can go to drdady@drdady.com and send me an email. And if you'd like to come in and do a consult, that would be great. Have a wonderful day. Thank you for stopping in.